So still addressing preeclampsia, which we said is a high blood pressure complication of pregnancy. So a pregnant woman is basically having, her blood pressure shooting up. So if blood pressures are shooting up, shows that what blood is flowing at some crazy speed. So this can what sadly cause some bleedings in her brain. All right, so that's what is known as what intracranial hemorrhage. Hypertension in general can cause it. Of course, even hypertension caused by pregnancy should also still be able to cause this problem. So for what we have, is a rare but it's a devastating complication. It can lead to significant loss of the mother. Also, you can lose the baby. Do you understand? So it's associated with what the woman has had severe high blood pressures. She has had HELLP syndrome. HELLP syndrome is what? Hemolysis. Blood is being what? Red blood cells are being broken down. Elevated liver enzymes, then low platelets. So the blood is just flowing anyhow without clotting. Even if there is wound, it will not clot. Do you understand? When there is bleeding, it will not clot. So why it happens? Elevated blood pressures in preeclampsia can make blood to move at some crazy speed that can rupture blood vessels in the brain. You understand? So pregnancy induced changes in vascular system. Maybe the blood vessels are basically softer at that time. Who knows? All right. So HELLP syndrome too. Okay. So risk factors. What could make a woman have her blood vessels in the brain rupturing because of pregnancy? So the blood pressures are what? I think I said blood vessels rupturing, right? So blood pressures are so high. You understand? Multiparity. She has many children that she's pregnant with, twins, triplets. Nausea and vomiting, lower educational attainment, delayed or inadequate antenatal care. All right. So clinical impact. It occurs in about just 1.8% of what preeclampsia issues. Right. Then nearly over 45% of women that find themselves in that percentage, they will die. All right. So neurological signs is sudden headache because there's a lot of blood, bleeding. So it's causing a lot of increased pressure. Seizures, visual disturbance, loss of consciousness. So management, rapid diagnosis. So if you dictate this quickly, it can help you. All right. So emergency medicines have to be there. Neurosurgery have to be there. Obstetrics people have to be there. Right. So they do a lot of imaging, just like I have an imaging here, just to know which side of the brain you are having the bleeding at. Okay. So treatment is blood pressure control, seizure prophylaxis, drugs like magnesium sulfate, and that the problem is the babies. So you have to deliver the babies so that you don't lose two parties. Do you understand? So that is what these complications could come up in preeclampsia. Okay, intracranial hemorrhage.